This is the second installment of a video series I'm creating all about treatment for primary progressive aphasia. So I'm a speech-language pathologist and I've been a therapist for 10 years now. Aphasia is the reason why I became a therapist, and I've become especially passionate about primary progressive aphasia over the years. PPA has been in the news a little more recently because of some famous celebrities who currently have the diagnosis. However, it's one of the more rare disorders of language. So in this video, I'm going to share a little bit about how a speech pathologist uses communication partner training for PPA. So this is an evidenced PPA or aphasia from a stroke. So this is an evidence-based therapy for those with PPA and their friends and loved ones. And there's actually a really great program and research intervention called Better Conversations for Aphasia out of the UK. And I will put a link to the website for that in my description. So in this video, I will incorporate some aspects of that communication partner training and modify it a little so you would know how to do a therapy like this step by step if you did not have a speech-language pathologist that you're currently working with. So we're taking communication partner training and making it a little more accessible for someone at home if they don't have a current therapist. Communication partner training involves working with the individual who has aphasia and their chosen communication partner. And it's really important to engage both parties since both parties are responsible for conversational success. And often the person with aphasia can benefit significantly from even simple actions of their communication partner. So what we do is we follow a 5-step process, which I will also provide a link to this process. It's a free handout in the video description. So first, you make a video recording of you having a conversation with your chosen communication partner. You can record it with your phone or any technological device. I would make sure the conversation is several minutes long, just so you have enough dialogue or interactions to analyze. And then second, you think about what felt easy in that conversation and what felt hard. And I want both parties to analyze what was easy and what was hard. And we call those conversation facilitators and barriers. So that could be something like, was the environment too noisy? Or was your communication partner interrupting? Things like that. Both parties will check off those facilitators or barriers that they noticed. And then this last step is you problem solve with your speech therapist, or if you don't have one, you problem solve together with your partner or with someone else, maybe the help of a loved one, to determine what strategies you could use in the next conversation that would bring in more of those conversation facilitators and less of those barriers. And in the handout, in the free handout below that I'll put a link in, you will see a list of facilitators and barriers in that, along with a little checklist, and then strategies for increasing the facilitators and strategies for decreasing the barriers. And I've based those strategies off of sessions I've had before working with people who have aphasia. Personalized strategies are still really important. So if you can work with an SLP, I highly recommend that. Why are we doing communication partner training for aphasia anyway? Well, it's because communication is hard for someone with any type of aphasia. Isolation, loneliness, mental health issues, these can all be prevalent in this population. Communication breakdowns are prevalent, and that can cause frustration for both parties. A good conversation is one that's balanced, and it helps two people feel respected. It allows both parties to communicate their ideas and their feelings so that they were heard. And it allows the person with aphasia to continue to make decisions for themselves and meaningfully connect with people.